inviting me on this occasion. And he has a detailed presentation on the Shingles vaccine, and of course Dr. Veenu Jamwal presented a detailed account on the adult immunization. But frankly speaking, I retired as medical superintendent at Gandhinagar Hospital. The common things which we had there is many times our staff got needle stick injury, and instead I started the program of giving hepatitis B vaccine to all our staff, because hepatitis B needs to be given to all healthcare workers, because needle stick injury is very common, particularly those who are dealing in emergency. Particularly, I have found a few patients with HIV, with hepatitis B, and people hide their disease because they think they will not be treated, they will not be operated. So this is one aspect. Another important thing is that just Dr. mentioned regarding dengue vaccine, just to tell you that it is a fact that Serum Institute of India, Poonawalla, and who had developed this Covishield vaccine during COVID-19, they will be coming with vaccine by December 13 with all serotypes, all 4, DN1, 2, 3, 4. All serotype vaccine is coming, and I think that will solve, because this season at Gandhinagar Hospital, we treated around 700 positive cases, and total cases detected by 600 cases were positive at Gandhinagar Hospital in our testing. So this is now coming to the adult immunization. Believe me, adult immunization in India is negligible. It's zero. I am not immunized. I have 60 plus. I am not immunized. Except during COVID-19, I got a flu shot for influenza. Believe me, when COVID-19 just lockdown was over and doctors were allowed to do practice. In the United States, one of my friends, they were not allowed to practice unless they got their flu shots. So this is the status. It is negligible in India. As doctors, we are not immunized. How we can expect people to get immunized, particularly after 50 years or 60 years? As you rightly recommended, definitely shingles should be given 2 doses after 50 years or 60 years. I think 50 years is fair enough. One should get that, particularly influenza as well as influenza vaccine. But as far as law is concerned, there is no approved adult immunization schedule which is being operated in India. But we always look towards the United States, definitely. So it was 1st October 2023. 1st October 2023 is a watershed in adult immunization all over the world, when it was decided that a voting was done. A voting was done by the ACIP, Advisory Committee of Immunization Practices. When voting, it was approved that make it compulsory for adult immunization in America, but somehow voting was done and approved adult immunization plan was made, and finally in the Annals of Internal Medicine on 11th of January 2024, fresh this immunization schedule has been available, and it is in the CDC website, it is available. And of course, new addition was only respiratory syncytial virus was added to that. Besides all other influenza, the flu shots, and then the shingles, these vaccines. And this finally on 11th of January, when it was approved by the government of USA, it was finally approved by the board of directors of the CDC, Center for Disease Control and Prevention, American College of Physicians, American College of Obstetricians and Gynecologists, American Academy of Family Physicians, and then American College of Nurses, and there are so many associations. Now, and if you see the data of America, 35% of Americans above 56 are immunized. This is the present data. So we are nowhere, and I agree this little bit, these inputs, I think this was a great move by Dr. Satyankar to come together on this forum. At least we doctors, we should get immunized. It really is irony, as Dr. said, that shingles is really a very dreadful disease, particularly patient to ठीक होता है, जम्मू में तो फांडे कराते हैं लोग, but उनको ये नहीं पता बाद में post herpetic neuralgia कितना dreadful होता है. We keep on giving gabapentin, pregabalin and so on, but ultimately patient को ज़्यादा फर्क पड़ता नहीं, थोड़ा बहुत improvement होती है, but then patient remains this sort of disability lifelong. So this is what I had to say, that I thank Dr. Satyankar Gupta for inviting me to share my views on that. In fact, when I was in Rajouri about 3 years back as district immunization officer Rajouri, when COVID vaccination was started on 23rd March 2021 on National Vaccination Day, I just shared a video on adult immunization 3 years back. And it was, at that time, I didn't have much, but it was circulating some WhatsApp groups. It's still lying with me, and in fact, it was 1 in 5 minutes. We had all scheduled. I just wanted that we should get immunized, just to see the peak of COVID. So this is, thank you very much for calling.
I think as COVID